Now, Health Minister Dr. Christopher Tufton also spoke about the missing vial today. His tone was, however, notably different from that of the Prime Minister on the gravity of the missing vial.
The audit is taking place, and the audit will determine the extent of the breach, if there was a breach or what actually happened. Once we determine what happened, then we'll determine how to proceed. What I will say, though, nearly 1,700 vials are accounted for. One is missing. So we have a lot of successes there, and I think sometimes we're judged against perfection, and the truth is none of us are perfect. So you'll always have issues. What we do is try to correct them as we go along, and I think the health team in the field have done very well in the first week of administering the vaccines.
Meanwhile, the health minister this afternoon received the first dose of the AstraZeneca COVID-19 vaccine and urged other Jamaicans to get inoculated. Dr. Tufton says he expects public confidence will build around taking the vaccine after more political representatives get immunized. Anthony Lugg tells us more.
Friday, March 19, 2021, 2:30 p.m. at the Spanish Town Hospital in St. Catherine. The date, time, and location, Health Minister Dr. Christopher Tufton received his first dose of the COVID-19 vaccine. There have been much debate over when this would have happened, but the wait is over.
This is my time, and I look forward to working on the front line with the nurses and the doctors and others to ensure that all Jamaicans get an opportunity to take the vaccine.
Leading public health experts argued that it was crucial for the two political figures leading Jamaica's pandemic response take the vaccine to boost public confidence amid concerns in parts of Europe. So, after being inoculated, journalists asked Dr. Tufton whether he believes his action would change the public's perception about the vaccine.
I'm not going to assess my own influence, because I don't think that is for me to do, but I do believe that as part of the leadership of the country and the standard bearer for public health, it's important that we demonstrate our commitment to the process that we're asking the country to buy into. We have expressed it verbally. We didn't express to a process, and we have lived true to that process. And I think we are now at the point where persons like myself, other members of parliament, and eventually the executive arm will take the vaccine.
The vaccination schedule was brought into question recently after the government announced that more than 5,000 government officials were to be among the first group of Jamaicans to receive vaccines. But after public concerns, the government changed the order, delaying the jab for some senior state officials, allowing only those 60 years and older. Some have argued that the younger politicians should wait until April before being vaccinated.
I don't think that that argument is an argument that I necessarily support. I believe that as leaders, we should provide leadership. And in providing leadership, it is as much as what we say, as much as what we do. But having expressed a process based on vulnerabilities, there is some validity in saying for younger people, you can wait a little while longer, and for the older people, you should get some preference or priority, or should I say the more vulnerable people. So frontline workers are clearly vulnerable, the over 60s and so on. But the truth is, all elected officials go out into the field every day and provide leadership on the ground. So we're all exposed.
So as the government ramp up its effort in the fight against COVID-19, Health Minister Dr. Christopher Tufton remains hopeful.